Hi, I'm Lisa Leatherman, and I'm here today to talk to you about the hospice nurse. The reason I chose the hospice first was respect for the area of specialty and level of compassion that they offer. Honestly, I don't know if I would be able to be a hospice nurse. You lose every patient you're dealing with. The goal is to help someone die with dignity. To feel the loss each time you lose a patient would be difficult for me, so I have the utmost respect for these people, these nurses. What is a hospice nurse? A hospice nurse is a nurse that focuses entirely on end-of-life care. They're preparing the patient for the end of life, for dying with dignity, basically. The primary activities of a hospice nurse is providing hands-on nursing care around the clock, manage pain and other symptoms. They also provide support to patient and families. Families are going through a lot. They're losing their loved ones. It's a lot of hand-holding and helping organize and take care of the patient. Again, they assist with the whole process of death with dignity. They help the family learn how to take care of their loved one at home. Basically, cleaning or doing anything that the family member may need if a CNA or the nurse is not there at that time. The hospice nurse may also order supplies or obtain the necessary equipment for the patient. They do ensure that the medications are available, such as pain medicine or any anti-nausea medicine is available at the time if the patient does need it. Other nursing activities continued. They perform their assessments as usual. They create a plan of care like all nurses do. They provide education, supervision, and direction for all caregivers and staff members. Meaning, they provide supervision for the actual family or the loved ones and education on how to take care of the patients. Any CNAs or nursing assistants that may come, they're supervising their actions, giving them directions, and creating that plan of care for everyone so that ultimately that patient can die with dignity. They coordinate with spiritual advisors. If they have a minister, if they have a plan, or they don't have a plan, they call someone to possibly talk with them about this so that their end of life can be carried out the way they want, including their funeral, all of their wishes that a patient might have. Teaching for patient families. They teach them what palliative care means. It focuses on providing relief for symptoms, pain, and physical stresses, and mental stresses for families that are going through this. It's a very hard thing to deal with. A lot of things that are unanswered you need help with, and that hospice nurse is there to do that. It deals with every stage of the illness. It's just they're there to help that patient die with dignity. They also teach families and patients what to do next, what to expect next, what death looks like sometimes, and instructions on what to do when. Sometimes you're at a loss, you don't know what to do. They tell them step by step what to do, and there are phone calls and there are people available if they need them, basically. The education that you need to prepare for this role, you need an RN license. And you need training in hospice nursing. And not everybody can do this. It takes a lot of compassion. And we'll talk about that in the next slide. The necessary skills and abilities needed. Communication skills, definitely. You're dealing with family members at their worst. They're losing a loved one. You have to have someone that can communicate effectively and speak with these folks. And help communicate, educate. And definitely the biggest thing, I know all nurses have compassion, but to me a hospice nurse has to have a lot of compassion to be able to deal with this end-of-life situation that they have to deal with. And taking care of the patient, it's not easy. They potentially go to work every day knowing that their patient could die. Most of us are in nursing to help a patient get better. Their main job is to help a patient die with dignity. And how wonderful that would be to have someone there with you by your side to do that. I myself, I don't believe I could do that, but these people are wonderful. If you look at the Community Hospice website, the Community Hospice Northeast Florida website, they have some upcoming events and education available. They have a grief seminar available in Gainesville, some long-term care conferences, spirituality information, and also an annual derby run to raise awareness and money for hospice care for people that can't afford it. So that is a good website for resources, or if you have a loved one that needs that. Keep in mind, we all know someone that probably has been in hospice. For me, it was my grandmother. And to see that type of care happening to a loved one and being out of control, basically, that person stepped in and helped us immensely. And I can't say enough about them. The references I used were Community Hospice, and that's the Northeast Florida Community Hospice website, and Crone. The Crone website gave me a lot of information about hospice care and the nurse. What I'd like to say to you today is it's very hard job for some, and it may come easy for others, but I just don't know if I have the ability to support someone through that, I guess because I've been through it myself. It was very helpful. The hospice nurse, all of them are wonderful. You couldn't ask for a more dedicated, compassionate nurse. And that's my information on a hospice nurse. Thank you.